And so we have our good friend Marcos Mejia, who comes from the county of Sonoma, and he's going to update us as to what's going on with COVID. And I am always grateful for the opportunity to have this dialogue with you. Thank you again for being here. What is going on with COVID since last time when we spoke?
Well, Rafael, there are important progresses in the roads of vaccination and testing. So let's start with vaccination. There is now 82% of the population of the county that is fully or partially vaccinated. 1 year ago, we were thinking that this would take us to the threshold to meet herd immunity. Sadly, because of the variants that continue to evolve now, we have Delta present, and in the short future, we have Lambda already lining up. We don't meet that threshold yet because of the unvaccinated population, but 82% is an enormous progress, especially when we compare it with the rate that the state or the country itself has. We're going ahead, but it's not enough. We have 21% still unvaccinated. That is close to 110,000 people, including all the children that are still not eligible. And we will talk about that shortly when we talk about the schools, because they're being affected too. But mostly the young people from 16 to 35 years old are still the groups that are receiving a big impact from Delta, because they are hesitant to vaccinate, to get the vaccine. I don't know why. There are so many reasons, but there's still those two groups that are more reluctant to take the vaccines. However, this 82% represents 350,000 persons or residents in the county that are with at least one of the doses. The number of daily doses has increased to 1,400 doses per day in average. And when we compare that with the numbers that we have in July, which was 737 doses, this talks about nearly a 40% increase in vaccination. And that, in my opinion, is something to celebrate. I encourage people to continue paying attention to the need to get vaccinated now. And testing is also increasing a lot, 88% in the last month. So it almost doubled. It was close to doubling. We consider that on the one hand is the Delta variant, on the other hand are all these different ordinances that began early in August to send employees for full vaccination or a weekly test with a negative result. It's not only institutions like the county that has established it. Yesterday was the city of Santa Rosa who dictated this ordinance, but also a lot of private owners of private business that are mandating this, like bars and restaurants. You may see that they are requesting vaccination cards or deny access. So they are protecting their employees, and they're doing the right thing, because last year a lot of business needed to close because the employers were affected by that. Or we also have heard that a lot of people is having a hard time hiring staff because people don't want to get sick. So all of this is a reason why we're seeing this increase in the number of testings. We're averaging 494 tests per every 100,000 persons that live in the county. So when the county made this association with LHI, Curative Molecular Matrix, and Fox Home Health, through that association, we were able to expand our capacity from 1,000 tests in the county to 14,000 tests per week. So, and although we have large capacity, we also have 88% increments on the testing. So what we are recommending is that the people that is in need of doing a test, book an appointment. Previously, we were saying no appointments required. Walk-ins are welcome. But now it's different because of the demand. The demand is high. So please check socoemergency.org, where you can see the details of where and when and how to make your appointment. The numbers of continue to increase, unfortunately. We are seeing some trends to downward trends, but the numbers continue there. So the new daily cases per every 100,000 inhabitants is almost 20. When we break that into vaccinated and unvaccinated people, we're seeing that almost 31 persons per every 100,000 are getting impacted. Those are the non-vaccinated, whereas almost 6 persons that are vaccinated are getting impacted by COVID. That's almost five times more impact in the non-vaccinated population. The hospitalizations are now 75 patients in the Sonoma County hospitals. 19 of them are in ICU beds. And also we needed to report more COVID-related deaths. Although we had reported 21 during August and 16 in July, last Monday we needed to report 3 more people who passed away due to COVID. 97% of the 356 deaths that have resulted for COVID during the pandemic have been among people who is unvaccinated. However, we also had a few that were vaccinated, and what we know about these people is that they were in their 90s, most of them, or younger, some of them, but they also had something in common, and that was that they had underlying health problems. We have talked here in your show about people who has a weakened immune system or weakened health. It's more important that they take care of themselves and they wear the mask, even outdoors or in interiors of places, because they're being affected, unfortunately. Many of them are eligible now for a third shot. You know, the persons who have immunocompromised receive organ transplants, they are eligible now. So talk to your doctor if you need the third shot now. Otherwise, we all are going to be expecting the boosters by the end of September to get started. And although I am reporting 42 deaths during the last 2 months, August and July, it doesn't compare with the deaths that we had at the beginning of this year. We reported 150 deaths that comprises the months of December, January, and February. But the difference now is because 74% of the eligible residents are fully vaccinated, meaning that even if someone is infected with the highly contagious Delta variant, they are protected against the worst outcomes like hospitalizations or death. I was mentioning that the groups between 16 and 24 and 25 to 34 years of age are the more reluctant to get vaccinated. They are only 60% roughly vaccinated. So we need these young people to get vaccinated. As for the schools have reopened, as we know, and so far we have to report 201 school-related cases of COVID. 107 occurred in primary schools, 93 occurred in secondary schools, and out of this total, 882 students were affected and 19 staff was affected so far. So that's sad. We expect that these numbers will continue to increase because of the debates that we have with the rejection to universal masking, which is the recommendation from the scientific point of view. But as we know, there's enormous resistance to it, and that has a direct impact in the number of people who's been impacted by COVID. Lastly, I'd like to talk to you, as I offered last week, about the Emergency Rental Assistance Program, or better known as ERAP for its names. The county still has 25 million available for eligible tenants. We started with 32, now we're down to 25 million. And I just want to remind your audience that the program provides payment assistance for tenants who were or are behind in rent and utilities. It also offers options for homeowners to participate and receive financial assistance. This program is open to all county residents, regardless of their immigration status, renters or owners. So we have received so far 3,945 applications that were submitted and approved, and 70% of those applications were tenants. So tenants are encouraged to apply because the changes of the program now have made the eligibility much easier, including the use of self-attestation of whatever they declare in their applications. The easiest way to apply is to call 211 or visit our socoemergency.org /ERAP, where you can find a list of community-based organizations that can help these persons enroll and guide them through their eligibility process. The restrictions have lessened a lot. So now it used to be one application per household. Now it can be one application per person in the household. So if you have roommates or if you live with other families, all of you can apply for this program. The program is paying 100% of the rent that you owe, and also 100% of the utilities, including internet or telephone or power. So just check socoemergency.org /ERAP for more information, or call 211. And that's my report for today.
And I appreciate, as always, the time that you dedicate to do this report on a weekly basis for us and our community. Just my last comment here is at 6 p.m. we are going to have in Spanish, and we'll see if we can repeat it in English, but we'll have Dr. Enrique Gonzalez Mendez, who's going to come over and give us a little bit more detailed information about the vaccines, the different type of vaccines, and so on. And we're really going to work a little bit on just undoing some of those mistakes that people make in regards to, well, the vaccine is going to make you sterile and the vaccine is going to do that. So we'll work on that. But again, thank you. The last two things I'll mention really quickly, because I know I have my next interview waiting, but that is in my class, right? I only have 22 students at Santa Rosa Junior College this semester in one class. And by the second session, one student didn't make it back because he got COVID. He went with a family member to a family gathering. Either, for sure, it seems like him and a few other people in the household were not vaccinated. Somebody had the virus and they infected a few people. So now he's losing class time because he has to sit at home and wait. And then the other piece that, this is a matter of public record, but faculty, staff, administrators, everybody's going at each other at Santa Rosa Junior College via emails. And again, I mentioned that this is a matter of public record because any email at Santa Rosa Junior College is public. And again, the attacks. Nobody can tell me to put a vaccine. Well, what are your rights? And at what point your individual rights are more important than the protection of everybody else? Again, this debate is happening everywhere. And I bring it up because, as I've said multiple times in other conversations with other people, some people would think that some of these individuals with bachelors and masters and PhDs or EDDs would be able to do what we call critical analysis. But it's politics that tends to win often, other than science. And we are seeing it at the national level, and we're seeing it at Santa Rosa Junior College. Again, thank you for taking the time and being here with us. And I look forward to our next dialogue. I'm going to reach out as a member of the media to Santa Rosa Junior College, and I'm going to ask for copies of some of these emails for next week, as well as I am going to ask them to give me a report as to how many individuals have tested positive for COVID at Santa Rosa Junior College and how many vaccines they've given over the last couple of weeks. So thank you again, Senor Mejia, for taking the time and being with us, and I look forward to our next dialogue.
I foresee that we're going to continue talking next week about schools and the impact of COVID in schools, yes. And it's going to have a long stretch. And it's due to these debates that are unnecessary, really. All of this is preventable. And it saddens me that it's just going to continue increasing.
That is correct. Thanks again. Right. We'll talk to you next week.
See you next week. Thank you.
Bye-bye.